It's 2 o'clock, so I would like, if possible, for everyone to take a seat or stand should you choose to. And all of my leadership team that's here today, I would like you to please be up here and be available for questions or comments. I'm going to make some comments, and then we're going to let Judge Floyd make comments, and then Dr. Vretis. But everyone else is here for any possible questions, concerns, or ideas for us, in terms of always knowing that we don't have all the answers, that all of you out there can help us help the citizens of the city of San Angelo. So thank you for being here. In the spirit of Thanksgiving, I want to thank those of you who have reached out and offered your support and gratitude for all that we are trying to do to keep our citizens informed and healthy. Thank you to those who have called or emailed with your concerns, support, and the stories you have shared about the impact of COVID-19 on your family. For the families that have not had to deal with positive cases and quarantine, you are becoming a very small part of this community. Today, we are asking that our business community continue to partner with our citizens by abiding by CDC guidelines. We are asking our citizens to be a partner with our business so that our businesses can focus on being successful, keeping their employees healthy and employees hired. Your support of our local businesses is vital. Several businesses have had to close because too many of their employees have been exposed to the COVID. Our number one goal is to keep the community beds available for those in need of care. Our businesses focused on serving this community and keeping their businesses successful. Our citizens are the first line of defense in fighting COVID-19. Our health care is the last line of defense, and they're certainly not the first line of defense. San Angelo has always been a community that joined hands together in support of each other and of those in need. We need to continue in that spirit. We must have healthcare workers. They have been devastated not only by the hours required to take care of patients, but citizens have certainly been impacted by the mental and financial impact of COVID-19, let alone the deaths in their families. We must continue to have respect towards our fellow citizens, and we must take responsibility for being part of the solution instead of the problem. I'm going to review, and I think they've got information to put up on the screens, and so it will be there, but let me just refresh some of the numbers from last week. Our positivity rate dropped from 24.6 to 17.5, so the good news is the positivity. We had 169 fewer positive cases this week, and obviously because of the positivity rate dropping, it also means that we've had fewer people being tested. Our hospitalizations have maintained 80 people for the past, I think, 3 days, but remember, the hospitals have stayed at 80 because we've had 8 people die. So that has lowered the hospitalization numbers. Each of us plays a part. We will say that over and over again. I know that you want all of us to be able to provide the solutions to solving it all, but it takes a community. It takes each citizen being a part, once again, of the solution and not the problem. I know that many of you will want to enjoy that with families, but also remember that COVID-19 exists in families, in small social circles, in backyards, in living rooms, in schoolyards. It is with us. It does not look like it is letting go anytime soon. And what I want us to do is to continue to be somewhat of a bright spot out here in West Texas compared to our other surrounding communities of Abilene, Midland, Odessa, and El Paso. The numbers are a reflection of this community and how seriously this community reacts to and takes responsibility for holding the numbers down and keeping us in a healthy spot. I'm going to turn the meeting over to Judge Floyd and let him offer some comments.
There's been a lot of information and a lot of communication within the last week since we had this last time. I'm standing here today, and I'll have to say I'm cautiously optimistic, much more than I was a week ago when we were here, and I'll kind of line that out. First off, I want to thank the mayor, Daniel Valenzuela, Teresa James, and Brian Groves, because back in March when we first met here, all of our community partners, the city offered up their website and their public information office to try to be able to post all information in one place to try to make it as transparent for the citizens and as easy to find. The latest example of that is the one-page information that was posted a day or two ago that basically outlined what we had been saying since basically the middle of May. The mayor's had very little authority in enforcing things locally. Mine is indicated as a little more, but in reality very much restricted by the governor's orders about things. So with that said, and also we try to make it transparent, tracking this mythical 15% hospitalization rate numbers that I've been trying to say, that's very directly related to me because of the Alcohol and Beverage Commission under the governor's orders to allow bars to open and restaurants to go to 75%. We're trying to post a link to that where anybody can track that. Obviously, those numbers change daily, but there's two numbers on there that are vitally important to that. One of them is the number of hospital beds they say we have in Region K. The other one is the number of COVID patients. So it's not just Shannon Systems, it's the rest of them around there. And I'm happy to say is if we report the 80 number that we're showing today and our hospital rooms that are available stay the same on that website, our 5-day moving average ticks down below 15%. For the last 5 days, we've hovered right in there. So it gives me hope we're at least the citizens are kind of controlling that. The next reason kind of for some hope is, for one, obviously, if you watched the governor's press conference yesterday in Lubbock rolling out the antigen therapy. I'm not even going to try to butcher the name of whatever the Bamblian or whatever it is. But there was pretty high confidence that this has the ability, a number of patients, to keep them from being hospitalized, which really the hospital capacity has been the main focal point since March, since we started all of this, is to maintain the delivery of healthcare services within the community. It's even more crucial now because we're somewhat on an island by ourselves because of what's going on really surrounding us all the way. We have seen increases, but many of the other areas, as Dr. Soni, the regional health authority out of El Paso on a conference call said Wednesday, there's 45 counties in her region. She said, let me put it this way, other than Erie County and Loving County, all the rest of them are worry counties because of the trending. Well, that limits calling in the cavalry if you need help, transferring patients if you get overloaded. So we've really become what San Angelo's been for decades, is kind of an island on ourselves. But the next thing I'm encouraged about is the number of calls I've received in the last week from businesses, planning events, all even through our annual stock show and rodeo next spring, trying to determine where we're going to be. All of those are attempting to put in the safest protocols they can and still have an event. I appreciate that. So I know there's a lot of interest. Of course, private businesses, a lot of people mix government organizations, city properties, outdoor events in the county, and businesses into one group. Businesses are a little bit different. They have a different method of doing business. All along it was said you're not going to go to jail for not wearing a mask, but you can certainly go to jail for violating a criminal trespass warning if a business gives that to you. So that's been there since day one, forever. A business has been able to do that. So businesses have a little more control of what we do. We are basically, our guidelines are dictated by the state. Much less, you see Colonel Nazario up there. You know, we all have a superior authority that we have to answer to. Ours is the state, and even within the county, we have the Office of Court Administration, we have jail commission standards, we have on and on and on, that are issuing guidelines that county is trying to deliver service to. But I think the citizens can read the numbers the same as we are. I think they're making adjustments. That's all we can ask for. Yesterday, they certainly indicated that this medication may help in the interim until the vaccines start arriving. There's a lot of enthusiasm about the vaccines. Obviously, they will start with medical personnel and go down through a priority list. There's several of them are a super deep freeze that can only go into certain areas. So depending on your locale is what type of those vaccines that will come. But hopefully the sooner the better. So that's the reason for my cautious optimism, is that we see maybe some light at the end of the tunnel that we can get through this. I say that I'll follow up with the same message yesterday that was in Lubbock from Dr. Hellerstein, NIMS kid with the Texas Department of Emergency Management. We're not there yet, so the separation probably is the most important, your hand washing. The mask, obviously, if you have to get within 6 foot of someone, is an added security. Forever study people have passed to me about they do no good. There's another one that comes down from someone else that says, yes, they do offer some help. But bottom line is Dr. Hellerstein with the state says they do some good. That's passed to Dr. Sony in El Paso, down to Dr. Vretis here locally. So that is part of the governor's plan. So anyway, it's really about all I have. Again, I have some cautious optimism in a way, a little bit reluctant to put that out there, but I just have confidence in the citizens here that they're looking at the same information that I have, and they have family and friends and fellow church members and workers here, and so hopefully we can continue this trend, and maybe if we can avoid the further restrictions, or at least possibly get a little bit of a waiver for a week or two to see if we've got this under control, is a possibility that we will certainly explore. Thank you, Mayor.
Dr. Vretis, would you like to come forward?
Good afternoon. I was just going to kind of give you all a little update of what's going on as far as in our area locally, and specifically at the Shannon campus downtown. All last week we were overrun. I'd come to work and have 10 patients waiting for admission in the ER, and leave work and have 18 patients waiting for admission in the ER. When I left yesterday, it was down to 8. When I got at work yesterday, it was only 3. Shannon's opened a lot of more beds in the COVID unit, and they're trying a novel approach with COVID. Up till now, we've been the one that's taking all the COVID patients throughout our area. Everybody in trauma service area K was sending all their COVID patients to us. We were overwhelmed and really unable to handle that. So what they've started doing now is they've worked out a deal with a lot of the surrounding hospitals that we will back transfer low acuity COVID patients to them, so that we could accept their high acuity patients there at Shannon. So this gives us a chance that we could do what we're best at, taking care of the people that are really, really sick and need our level of care. But the people that just need floor level care, we can send these back to the communities they came from and help decompress our main hospital. As Judge Floyd said, we've started giving the monoclonal antibody, Bamlanivimab. Everybody calls it Bam Bam because nobody could say it, so we're giving Bam Bam now. This monoclonal antibody has been shown to decrease the need for hospitalizations if it's given to somebody very early in the course of their disease. It doesn't work, at least it doesn't appear to work, if you give it to somebody who's already hospitalized, because by that time they've already made enough of their own antibodies, it doesn't seem to help. But if you give it to somebody early in the course, those antibodies and make it so that person doesn't get really sick and doesn't end up in the hospital. So we're really excited about this. We're anxious to see how well that goes. Like Judge Floyd also mentioned, there are several vaccines that appear to be moving fairly rapidly along towards approval, and we're expecting somewhere into this year versus January, we should be having a vaccine here in town, and we're really looking forward to that.
Hi, John Tufts, Angelo Standard Times. This question is for Judge Floyd. Can you brief the community on whether or not we will be seeing compliance officers in any of our businesses at this time?
Well, of course, I think the manner of which are approaching that, Dr. Vretis could answer more, but no. Since last Friday, we haven't needed any compliance officers because I have had plenty of people contacting my office telling us about violations, whether they're businesses or this and that. And I'm sure, again, I believe there's a letter that Dr. Vretis under his cover that if anybody visits them, they just give the sponsor or the owner of the business a copy that reminds them of the guidelines at this point in time. So that is really the limit of what we were only going to do. I actually have not received any complaints about anything out in the county that would be something that I would ask the sheriff to do. Of course, there hasn't been many events out there during this course. I think there's some this weekend possibly. But again, I can't speak from what the city has had, but I've seen a copy of a letter that's being delivered. And all it is reminding them of the guidelines. And then from there, it will be in Dr. Vretis' hands, whatever occurs.
All right, and as far as our rolling day average is concerned, I know on the screen there we have Region K highlighted. It says that our current hospital beds, I think somewhere around the 620s, and the number of patients they're saying is I think 92, if I'm seeing that from this distance. Do you know about where?
Well, that's what I was saying, right with those numbers, which were yesterday's results. And if you see over on the left, it says it will be updated daily by 4 p.m., and you see the last time it was updated. So obviously there's a tremendous amount of information on that and a tremendous amount being fed into it daily. But that was what is a reference when you're looking at K, is that our total staffed hospital beds went from 540 to 623 overnight. If it wasn't for that, what does it say as far as patients, that would have blown our numbers way out. But as it is, we were just a tick over 15% for a 4-day rolling average. If those beds stay the same and we report the 80 today that are the preliminary reports, then that will move us to about 14.7 or 14.8 for a 5-day rolling average. So it's trending in the right direction. You know, the last 5 days it had been trending in the wrong direction. It kind of flattened out some. And of course, like the mayor said, we've had more deaths than what we need. So that's what we're monitoring. I have some limited information about where all that comes from and who makes the decision of what's posted. But primarily I'm limited to looking at that when they update it this afternoon. And then what I will know is what DHHS is looking at and at what point in time they may choose to call the Beverage Commission, who will in turn contact me that we have exceeded that. But if we're reading that correctly and what I've been told how that's going to be calculated, we're safe for a 5-day average right now. Well, I think it was 556 for a long time. It went up to about 580. It moved to 575. 2 or 3 days ago, it was 540. And then this morning, it was 623. I cannot answer that. I really do not know. Again, it's just the data bank that the states in terms of any contact that they make with me. But what I've been told as of Wednesday with Dr. Sony out of El Paso, how they were going to calculate that. I think it's the same information I've tried to make as public as I can so the general public can track that. Then, you know, bottom line is they can be a predictor. The whole reason I wanted people to know is so if the event we continue to track in a negative way in terms of our percentages, that unfortunate bar owners and restaurant owners would at least have some advance notice and be able to track them to make whatever plans they can. If today's numbers hold, it's a reason for my cautious optimism. Maybe we can just ride the wave right in here. And I was made aware of an appeal situation to that, or a waiver, if you would, for a period of time, maybe a week at a time. But they indicated that all other indices would have to be very, very low for that to occur. But if we basically can flatten this situation, and hopefully maybe the bam bam, as Dr. Vretis, as far as that works for me, if that has an effect and we can flatten or reduce that hospitalization, then it really gives a better, we're still not through with it. We still have a lot of people that are affected because, we also have about 170 or 80 patients that are being treated at home with hospital staff at times, nurses and things. So we have a lot of people and a lot of families affected. We've had several departments this week within the county have been affected because of outbreaks within that staff. Our clerk's office opened back up today. We had to disinfect that whole building. One of our Justice of the Peace offices are extremely limited staff right now. The court systems made some adjustments because of the interaction out of the clerk's office. And that's just Tom Green County. Obviously, Council of Governments canceled the meetings that we normally have on Wednesday because of an outbreak within staff there. You saw what the school district, the adjustments they made for the game tonight. You're seeing those adjustments all over the place from various organizations and business and things. And so they're reading the information, and I think they're responding to it positively, and hopefully that will lead to a flattening of this, and we can remain at this posture. And if the community partners agree, if we're just close to the line, if we want to appeal as a waiver for a period of time to see where we're going, I could support that.
Any idea on how long such an appeal would take?
No, I don't know who evaluates it. I would not believe somebody within TABC. I'm assuming probably somebody in the health services department's the one that's going to evaluate that. So I didn't even know it existed except for a phone call Wednesday with TABC trying to find out some information about the process. Again, to pass on, I shared with him what I was attempting to do is try where our business owners could see the same things they're looking at and I'm looking at. But he didn't share much of it. It's not published anywhere that it's even available. Doesn't have any criteria, but this was just verbally that was given to me that there could be a waiver request if it was just kind of an anomaly that you went over during that period of time, but you're trending down, your positivity rates, all of the other indices were tracking good, that they could issue a waiver. So I know it's out there now. We'll just see what the numbers and the facts on the ground at that time are before we would decide what position we wanted to take on that. I have no desire for anybody to have to close down. I just want them to try to do business as appropriately as they can and as safely as they can so we can maintain this posture.
Joe Hyde with San Angelo Live. How y'all doing? I got a question about the vaccine as far as the delivery of a vaccine. I know there's two of them. Dr. Vretis can answer, can be responsive to these. The biggest economic driver of this town is the rodeo in February. So how fast can we get this vaccine distributed and out there where it's having an impact, and perhaps we can have a bigger rodeo than probably what they're planning right now?
I don't think we can do it that fast.
You don't think it's going to help at all?
It's going to help some, but I don't think we'll be able to get everybody done that fast. You don't want me lying to you, right? If we can get, vaccine the end of next month, early part of January will be great. But again, it's going to go primarily, I guess, the first group will go to healthcare, EMS, kind of essential service people, and then it'll be spread out to high-risk individuals and go from there. But, you know, by February, I don't expect to see a big change by February because it takes a while to actually develop antibodies and stuff after you get the vaccine.
So when do you think, if we were to start distributing to healthcare and first responders and things like that in, let's say, January, when do you think we're all seeing, right? There's a little glimmer of hope?
Oh, I see a glimmer of hope, but it's not for February. I think, you know, maybe April, May, we should be doing significantly better.
Okay. The next question I have about the vaccine is, and this is probably for all the government, is there's a lot of people in this town. This is a very entrepreneurial town. We don't have a lot of corporations employing people unless you're in the Air Force or work for ASU. So there's a lot of people there in the middle without health insurance or with high deductibles. What kind of financing, what kind of plan do you have for paying for all those vaccines, or are they going to start charging everyone for it? And how much would you have, you know, are there any plans on there to get this thing rapidly distributed? And so that, you know, the single dad who is a plumber makes 45 grand a year, you know, doesn't have to go fork out $500 to get his family vaccinated. What's that? You
I don't know the answer for that. I mean,
okay.
Yeah.
And last one for Judge Floyd, I just want to clarify. The state of Texas is looking at the rolling 7-day average being under 15%.
Over under 15.
So it's a rolling, so when we go under 15%, it doesn't reset anything. We're still vulnerable.
Well, again, it's a 7-day rolling average. So
Okay.
if you look at 2 days, 7 days, if you look at 7 days, we're 12 or 13% because we went from a fairly low percentage up higher, basically when we lost hospital beds. So that rolling goes over, and you just look at the last 7 days.
Okay.
I was just using the last 2 or 3 days is to try to use as a predictor, is if we stay on this course, you know, 4 or 5 days out is when we'll hit it if we stay on this trajectory. You know, so there's a number of different ways to look at it. Can I comment on your question about the cost of the vaccine?
Yes.
I think there was, in Governor Abbott's presentation yesterday, I think he clarified a lot. In fact, I snickered that he finally admitted what us local governments were knowing that was happening. And there was a 2-tier distribution of those CARES funds that came down in April. And communities, cities over 500,000, it came directly from the federal government, blam, and they took off. Everybody else, it went to the state, was distributed through the state, and 20% is all they authorized up to this point in time. And we're actually going through the process of filing the audit on that of where that was gone. That was supposed to have been in by the 15th of this month, and I think they actually extended it till the end of the month to get everybody in to audit to make sure those funds that are going. The rest of it was held by the state, and of course the state's been out a tremendous amount of money with PPE. I don't know what it costs to send a 100-person team of nurses and doctors to El Paso for 2 weeks at a time, to send mobile morgues and that sort of thing, but obviously there's a great deal of state cost. And I think probably part of the answer is to that some of that money was being held back for what was being predicted that we could have challenges going into the fall, which are manifesting themselves. And I'm hoping that the state has held back enough money to take care of anybody's financial concern if they want a vaccine. Now, that's not coming from the government. That's just reading the tea leaves and some communications yesterday that's the first of what we have had. We have been kind of frustrated that the state was holding on to that money. But I think we all knew the reason they were doing it, but that was expressed yesterday, and probably it's going to pay benefits as this plays out.
And one more question for Dr. Vretis. The nursing shortage, or Shannon came out and said they were looking for nurses. Can you address healthcare worker availability, HR situation we're in right now?
Yeah, actually Shannon did get several traveler nurses and nurses from the state, and that's what allowed them to open their COVID unit all the way up on the 6th floor, I think. And now we have capability between the sixth-floor COVID unit and the intensive care unit, which has been converted to be completely COVID now, the regular intensive care unit. I think we could handle 91 patients there. And I don't think we're staffed for completely 91, but we're significantly better. I mean, it's way better.
All right, one thing is from a reader. All right, he wanted for you to tell us what kind of treatments are happening right now for COVID, because we talked about the new thing. What is that thing called? The
Bam,
Bam Bam. So we have the Bam Bam, which is new.
Yeah.
How else is Shannon or any hospital here treating COVID patients?
Okay, pretty much standard of care around the country is if you have severe respiratory distress, you get Decadron, dexamethasone, which is a steroid. Remdesivir is not living up to our hopes, and it doesn't appear to be worthwhile as far as inpatient people. Everybody gets zinc, everybody gets vitamin C, D, multivitamins. A lot of people need oxygen support, and so as it goes varying from nasal oxygen up to face mask to BiPAP, and then the unfortunate few that end up on ventilators in intensive care. And that's about it. You know, we've changed kind of how we handle a lot of these patients. The people that only need supplemental nasal oxygen that we might have admitted 3 weeks ago, now we're able to actually get oxygen brought to the emergency department and discharge them directly from the emergency department home with their oxygen. And that again, helps decompress the hospital. And, if you're going to be miserable on oxygen, you might as well be miserable at home.
All right, since you're a doctor,
Yeah,
if you're at home or you haven't gotten the COVID yet,
yeah.
what vitamins are we supposed to take?
I tell you what I take.
All right, what do you take?
I take zinc every day. I take vitamin C, vitamin D, and multivitamins. I do the gummy multivitamins and just chew a couple of them. It's kind of like a dessert.
That's all I have. Thank you, sir.
Further questions? With no further questions, thank you for being here today. And our next one will actually be on December the 3rd. We will not have a press conference next week, with Thanksgiving being part of next week. So December the 3rd, which is a Thursday, at 2 o'clock here in this same room. Have a great Thanksgiving, everybody, and thank you for being here.